Hello, everybody. I'm back. Dr. K. Agarwal, President, Heart Care Foundation of India and Confederation of Medical Association of Asia and Oceania. And you are watching Med Talks with Dr. K. Agarwal, 189th non-stop Med Talks edition and 1516th COVID session. Let's have the headlines of the day. 1 million COVID-19 vaccine doses were administered in last 6 days. This is the fastest way vaccine can be given in the community. Study shows the immune system of recovered COVID-19 patients may evolve to fight coronavirus variants. Aviation sector workers to be vaccinated on priority after the health workers. 9 active cases of COVID-19 in Australian open quarantine, officials report, and positivity rate less than 15, except in Kerala, Maharashtra, and Nagaland. In Delhi, the latest Sero survey says over 50% of the people have already developed the antibodies. Before I introduce the special guest, let's have the ritual of washing our hand. We take the sanitizer solution and we say S for Seedha, U for Ulta, M for Mutti, A for Angutha, N for Nakhun, and K for Kalai. Once we have done that, we are ready to face and invite our special guest. Let's have the topic of the day. And that is ensuring the healthcare services, the experience from Bhutan. And I have with me my special guest, Dr. Tashi Tenzin, who is the consultant general surgeon and neurosurgeon. He is a surgeon attached to Jigme Dorji Wangchuk National Referral Hospital in Bhutan. He is also the dean and professor faculty of postgraduate medicine at Keshar Gyalpo University of Bhutan, a friend of Confederation of Medical Association in Asia Oceania, and Bhutan is a friendly country with Indian Medical Association who has received 150,000 doses of vaccine from India. Welcome, Tashi, to our program. So if you can hear me, you can give your presentation followed by a discussion. I think there is some problem with his computer. जब तक इनका कंप्यूटर लगता है, थैंक यू नूतन जी, केदार जी, गीता जी, शोनिका जी, सीमा जी, विवेक मुदगल, पूजा शर्मा, अरुणा त्यागी जी for joining. सौरभ जी, some disconnection तो फोन से कनेक्ट करा दीजिए इनको. So there is some problem in his. So one more good news I want to give is that British Medical Journal में एक बहुत बड़ा आर्टिकल आया है in favor of colchicine. ये colchicine वो दवाई है जो अक्टूबर से I have been talking about it in every case that we should be giving colchicine to reduce the mortality, and now the BMJ talks about that. The British Medical Journal talks about the same thing, that we should be giving colchicine and early enough. And they are saying colchicine is a steroid sparing drug. And I can recall in all my patients, when we have given colchicine, steroid had not to be given for a longer period of time. So colchicine reduces inflammation, reduces thrombosis, and it reduces fibrosis in the lungs. So now we know, and that's what my patients have been doing. All my patients have been on colchicine from day one. And this is the news which now BMJ is talking about is that colchicine should be given to all patients. We have been talking about colchicine in our evening 8 o'clock program also. We have been talking about colchicine is the drug of choice for reducing low-grade inflammation in all heart blockages also. Are we connected, Dr. Tashi? Ritu, are we connected with Dr. Tashi or?
Yes, sir, it's in 2 minutes.
Yes, Dr. Tashi is joining any movement from another. Yes, Dr. Tashi. No, he's still not. So till that, let me take प्रज्ञा मिश्रा. डॉक्टर साहब, क्या एनिमल से कोरोना स्प्रेड होता है? द आंसर इज नो.
You can hear me?
यस, बोलिए ताशी जी. नहीं, सौरभ के थ्रू आवाज आएगी तो फिर आपको अपना वो बंद करना पड़ेगा. सौरभ,
You can hear me?
Yes.
Can you hear me?
यस बोलिए. यस, आई कैन. कैन यू स्पीक, ताशी?
Hear me now?
Echo.
Your voice is echoing. In the meantime, can I see you? There is a Jyoti Gupta. My husband is 56-year-old and is diabetic. He was COVID positive and tested negative. He also consulted the lung specialist, CRP.
Dr. Tashi?
Can you hear me?
Your voice is echoing. Sonia ji, I'm 50-year-old, suffering from last 17 years with pulmonary arterial hypertension. Very good. But can I take the vaccine? Answer is yes. सोनिया, सौरभ, आप अपना माइक को म्यूट कर दो और फिर उनको सुनो. सौरभ, आप अपने माइक को म्यूट कर दो, फिर उनको सुनो.
Okay, wait.
So Sonia Naza has sent me a link. It's a tick.
Can you speak now?
Yeah.
Not working.
Yes, go ahead, Tashi. Tashi, go ahead. सौरभ, आपको अपने फोन का म्यूट बंद करना है, नॉट द इसका म्यूट.
आपको
My phone is muted.
Yes, go ahead, Tashi.
Can you hear me now?
So can you give him my number? आपने व्हाट्सएप कॉल लगाया या दूसरा फोन लगाया सौरभ?
WhatsApp call.
तो सिंपल फोन लगा लो ना.
सिंपल लगाऊं?
सिंपल फोन लगा लो, व्हाट्सएप से डिफिकल्टी आ सकती है. या मेरे को नंबर दो, मैं लगाता हूँ.
975
975
17
17
82
82.
1578.
शुरू में क्या लगाना है? 0
plus.
Yes, kindly speak now.
Yes, sir, President. I can hear you. Can I talk from here?
Yes. Is he audible, Ritu?
Yes, sir.
Yes, go ahead.
So sorry, Professor K.K. Agarwal. I think this is something new platform we are using. We got used to Zoom and other things, but this one is something totally new. Anyway, very sorry for that. But I must, from the outset, I'd like to thank Dr. K.K. Agarwal, President of CMAO, Padma Shri Awari, and I'm very happy to be studied with you and just to share about Bhutan's experience on how COVID has affected our healthcare, and especially maintaining the essential healthcare was, I think, everywhere it was a problem, but then Bhutan managed to ensure the essential healthcare despite shortage of human resources. So that's why very happy to share with you this episode. I don't know whether you have my slides, but
Show us the Ritu. Go through the slides.
so the topic is ensuring essential healthcare services in the times of COVID-19. I'm Dr. Kenjan. I'm a consultant neurosurgeon and a professor and dean in a medical college, only medical college in Bhutan. So I would like to just take through briefly about how we manage essential healthcare in Bhutan during the COVID time. Next, please. Just to highlight on the first case in Bhutan, I think it was just after a month it was detected in India. We had our first case detected on 5th March. It's detected in the 76-year-old gentleman, US tourist, who started his journey from Washington, D.C., but he traveled through India, somewhere in Guwahati, and he landed in Bhutan sometime on March 1st. But despite having symptoms, very, very vague symptoms like depressive symptoms, our emergency department, who end up frontline, actually did not even suspect about the COVID. But then I think it was a learning stage, those days, that only on his third presentation, he presented with fever and similar to COVID symptoms. That's the only time when we sent for antiviral, COVID rapid test, and then that came positive, and he was the first case. From 6th March, Dan declared that there was the first case here. And surprisingly, just to highlight that being from West, and he had comorbid condition of hypertension. He was managed initially symptomatically, but later on he developed respiratory distress and he had to be intubated. But with request from family from US, he was taken by a charter flight to US. And after a month or so, we heard very good news that he had recovered and he was doing very well. And the second case happened to be his partner, but initially she was negative. But only after her quarantine of 14 days, she detected positive. And the third case of Bhutanese happened to be a student who was studying in UK on his return from UK. She was tested positive. Next, please. And at this moment, when I just shared about the statistics of COVID positive case, we have confirmed 851, which are all RT-PCR tested, and we have 171 which are undergoing treatment, 679 recovered, and there was so far we only experienced one death so far, who actually had liver failure and his kidney failure, but on top of that he suffered COVID. A simple man of about 36-year-old. And I would not want to go through the number of tests done and really undertaken. It's a very, very significant amount of tests that done and will be taken forward. Next. Next, please. And just to highlight on our preparedness of the COVID, like any other country, we had a disaster preparedness and response plan, but the pandemic sort of situation was never been thought of. But then sometime in the early year of Jan, by the time the world was already seeing the pandemic, I think the Minister of Health has prepared its response plan and preparedness plan for the outbreak, and by early February, the plan was actually executed. Next, please. And like in any other countries, we are following the theme that any individual was tested positive, was quarantined, and then others were traced through something called a group trace. And IT people have started launching this group trace. And initially we had a challenge of people not being accustomed to using this, but subsequently we have found out that this group trace app has actually helped to trace the primary contacts and secondary contacts. And the testing, as I was mentioning, Bhutan has really taken forward in testing, and so many patients who have even a mild or common flu-like symptoms. And Bhutan's detection is mostly been done through our flu clinics. Over 50 flu clinic centers were opened, and from there, public were recommended to visit those areas and not to the hospital. So the positive cases were detected actually through this. And the treatment, I think, as a challenge all over the country and all over the world is that we were all trying what sort of treatment to be done. But so far, I think mostly are mild cases, and only in severe cases, antiviral treatments were given, and the steroids as the evidence is generated. And that's what I think our people who are taking active treatment, those doctors have contacted with people in India, consultants in India, Singapore, and Thailand. And that's how I think the treatment part is carried forward. Next forward. So the COVID situation, initially it was a cluster form, but then since there was a patient who had returned from Middle East, she was actually discharged after testing negative. In Bhutan, we followed instead of 14 days, 21 days was being instituted. And even after 21 days, she was detected negative. And while she was being followed up, after a couple of weeks, again, after 21 days, she became positive. And then the country had to be put under lockdown, considering that there is sporadic, but however, this was found to be a significant incident. So that the first lockdown was done in August for 21 days. And then presently we are still under lockdown. Second lockdown of 21 days was closed to 21 days. And now there is mass screening, and anytime we are going to open up. The whole country is now was in the green zone initially, then became yellow, and some of us in 2 districts like Thimphu, the capital, and Paro, where the airport is there, we are still under yellow zone. And after a week of mass screening again, I think we will be declared free because yesterday and today we didn't get any positive cases. Despite such a huge pandemic all across the world, Bhutan being a small landlocked, but Bhutan is not being spared because the country had requested all Bhutanese to return home for safety purpose. But at the same time, health is free in Bhutan. That's why many Bhutanese who are working outside, especially in Australia, UK, USA, and in Middle East, they returned and they were provided totally free quarantine, free fooding services. Anyone who is also suffering from COVID, they were being provided totally free health care. And that's why how we want to share with our friends across and nearby how Bhutan actually fared maintaining the essential healthcare services during this lockdown. Next. Basically, I think the other countries are doing the same thing, but in Bhutan, something very unique has happened was that the king himself, as the head of the state, was actually taking the lead. And very interestingly, our government has, at this juncture, have 4 cabinet ministers who are doctors. Prime Minister is a neurologist. The health minister is a public health specialist. Foreign minister is a pediatrician. And finance minister is infectious disease, especially the HIV program specialist. And that's why we had a privilege of having our cabinet as the health background, and that really helped. Although nobody had an experience on maintaining or managing pandemic, but then everyone joined together, and having cabinet ministers having health background has really helped. And right from the beginning, toll-free numbers were opened up, and people who had to just call the toll-free number. And even one example is people who are retired from the service and more than 60 years of age are considered senior citizens. Totally a dedicated helpline has been offered. And what the aspect of essential services that were provided was that since the hostels were being restricted for the patients to move in, teleconsultations were provided, which means the government provided free seats and mobiles to the consultants. They stay home. So they will guide patients whether they have to visit the hospitals. And also our prescription was being sent through our WhatsApp platform. And the pharmacy team will deliver the essential medicines at home. And there was uninterrupted emergency services. There was no problem in that because they consult the toll-free numbers and then the ambulance services are being sent there. With regards to elective surgery, especially the urgent cases, at the same time the cancer cases, those cases which may land up into complicated case if you wait, those are also being provided both during the lockdown situation. And there was uninterrupted immunization schedules, which is as per our immunization, essential immunization schedules. Those are being also teams to go around the zone-wise and they provide the primary health care services. I do not want to really go into non-health care essential services, but just want to highlight here is that right from the grocery to the toothpaste to whatever people really required at home or individually, the government has done in such a way that they are distributed to their homes, and there was uninterrupted supply of non-health essential services as well. Next, please. So what we used was temporal distancing. It's basically to protect our hostels. And that was done with the aim of protecting the public so that they don't go out, staying home. And at the same time, the staff who are working in the hostel are kept in the facility of health, where they have been tested and kept in the hotel, and from there they will come to the hospital and work. And the group of inpatient department, outpatient department, and the teleconsultation where met in the both the nurses, technicians, and the doctors are grouped in three. And the IPD and OPD also, they don't even mix. Although the identified places are there for them to stay, only the teleconsultation people stay home. And all the facilities are provided. Traveling buses are separately arranged for them, and then compulsory testing before going to the facility and for the work. And after 50 or 14 days, they have been tested so that they are safe to go home. So, although I think many countries follow either 5 days or a 1 week quarantine after doing a PCR, even doing a positive case, but in Bhutan, if staff attends a duty in a COVID positive cases, they work for 2 weeks and then they go to a quarantine for 2 weeks. And only after a good RT-PCR negative test, they can go home. So the safety of the staff, safety of the patient, and safety of the community was ensured very seriously. Next, please. And I want to just highlight those factors which really made the difference in Bhutan's scenario, that the leadership of the team. He himself went across the border, across to visit the communities where the volunteers were, because we had a porous border with India, and there were a lot of issue, people going to smuggle out to cigarettes, smuggle out to goods, and very, very significant problem of getting from the across the border. So the king personally went around and actually campaigned the safety of the people, and also whether it's health related or non-health related, he personally took the lead into unemployment, people losing jobs, tourism sector was really affected. Everyone who actually lost the job, they were compensated by a monthly remuneration, and people are well taken care of. And with regards to the government, there's so much of support from our friends across, especially Indian government, personally with Honorable Prime Minister and our good well-wishers in so many hospitals where they have been very helpful in providing technical support. And something unique about Bhutan is that it's a small country with about 700,000 population. The participation of the public, understanding, listening to the government, listening to the king, listening to the health messages, that really helps. And the volunteerism of the health and non-health people, because of the shortage of human resources, there was a problem of people doing non-medical issues, but even some educated people volunteered to undergo some sort of basic training in helping the healthcare providers. Although landlocked, I think the countries need to really understand that people have to support the government and to participate in the managing our own issues. So that internal resilience has really helped. And to really speak about the external support, as I was mentioning about every Saturday, which Professor K.K. Agarwal was conducting, and really updated our knowledge on COVID. Similarly, my friends who are connecting with Thai people, connecting with AIMS, connecting with Singapore, and this has really helped. And to just conclude, the last support that we received is my next slide, where every country was looking for a vaccine as the last cure, but we had a really pleasure of receiving our first batch of 150,000 vaccines from India. We just reached a couple of days before, handed over by Ambassador Vijay Bhutan. And this has been kept safe, and now this is to be used to people who will be traveling out. And we are waiting for the next batch of Covishield soon through the support of India again. Next slide.
Next slide, Ritu.
And so this has been highlighted already. The generous offer from, you can see, Ambassador of Bhutan, the Prime Minister and the Health Minister, and plus the beautifying the vaccines which was received in the airport. And this was very huge relief for Bhutan, and we will be waiting for additional support from India. So with this, I would like to thank Dr. K. Agarwal for his continuous support and providing knowledge, updating from the day one before even the pandemic was actually been announced by WHO. Dr. K. Agarwal, and we have a WhatsApp group, and we've been getting very, very updated
Thank
knowledge
you.
from you. So with this, I'd like to thank you so much for giving me this opportunity to share about that experience. Thank you.
Thank you, Dr. Tashi. And because of some internet disconnectivity, we could hear him. At least we could hear him. We may not be able to have question answers with you. The reason being, still the voice is having a double voice. What I'll do is I'll quickly answer some of the queries of the people who are asking their questions before I finish the program. Tara Tripathi is talking about post-COVID age 70 CRP 10. Yes, you take colchicine 0.5 milligram per day. And if your CRP is more than 10, take it for granted you have mild pneumonia. So Dr. Tashi has gone. I thank him for his presence from Bhutan. And he was the head of the Bhutan medical field. Jyoti, my husband is 56 years and old, is diabetic, COVID positive. Yesterday, he has headache and body ache and got fever of 99.7. So there is nothing to worry. You can have a fever after that. I am not worried about that. So post-COVID age 70, already they have said. Jyoti has already asked the question. Then let me see if anybody else has a question. I am a doctor in early 40s, multiple comorbidities. I have taken Covishield vaccine yesterday. Congratulations. Having lightheadedness since yesterday. How long it will last? You can take one tablet of mefenamic acid and it will disappear. And Sanjeev also get your CRP done on day 3 to see what is the maximum CRP rises in your case. And take mefenamic acid and it will disappear immediately. Then let me take a couple of more questions if there is any. He says, my father is a doctor. His sugar is around 315. Richaji, sugar 315 is very high. We cannot afford to have it. Bring it to less than 200. And if that will be your first aim, to bring it to less than 200, then bring it less to 140, then try it fasting as less than 126. But 315 sugar is very, very, very high. So post-COVID, age 70, Tara Tripathi, I've already given you the answer. Yes, Jyotiji, the antibodies are more than 10. The COVID has been taken care of. But CRP21, I don't like. Because if the CRP is more than 21, and if you have some non-neutralizing antibodies, you can have repeated re-inflammations. So therefore, I won't like having a CRP of 29. Today at 8 o'clock, I will be back answering your queries for CRP and LDL. Then 9 o'clock again, I will be back for half an hour on a weekly session on diabetes. But that will be live on medtalks.in, medtalks.in. And so I will be having 2 more sessions with all of you. Ombirji is setting mild right axis deviation. Forget it, Ombirji. Right axis deviation is sometimes normal, so nothing to worry. So how are you feeling after the vaccine? I am fine. Till now, I have no symptoms. Deepti ji, namaskar. And then Jyoti ji has already said. Bimla Kapoor ji is saying, I am post-COVID diabetic, CRP 0.6, antibodies 39. Should I take the vaccine? Yes, Bimla ji, you should take the vaccine. Your CRP and antibodies are positive, but even then, you should take the vaccine. The antibodies will increase. So what you do is take the vaccine and get your antibodies repeated after 3 weeks. That will help you in developing more antibodies. Let me see if there is anybody else who is asking so many questions. So let me summarize to everybody that the latest BMJ, British Medical Journal, has confirmed our finding of giving colchicine early enough. This is what we have been giving from day 1, 0.5 milligram daily. They say give it for 4 weeks. That was our standard protocol. And they said that if you give colchicine, it can become a steroid sparing and it can help in reducing lung inflammation, also systemic inflammation. So our one more finding has been verified, and that is early colchicine, which is a inflammasome inhibitor. It reduces IL-1 beta. So what we have been giving is colchicine starting from day 1, along with mefenamic acid. In fact, this was became our standard treatment starting from day 1, and add steroid only if we find there is a pneumonia. So, and when you give colchicine and mefenamic acid, then steroid may not be required for a longer period of time. That's what we have done that. So let me thank Dr. Tashi to be here and interacting with all of you. In the meantime, we have given you some of the answers. And then Jyoti ji is again asking, is the fever getting the CRP to 21? If you have Jyoti ji CRP 21, look for TLC. If TLC is high, then it may be a secondary infection and you may require an antibiotic. Pramod Agarwal ji is saying 40-year having diabetes mellitus controlled, creatinine 1.6 means you have some kidney involvement. D-dimer 6,000 on anticoagulants. What else can be done for the patient? So make sure D-dimer 6,000 is very high. The patient should be on proper therapeutic dose of anticoagulant. Add colchicine also, which will add and which will help recovery of creatinine. So Pramod ji, just add colchicine 0.5 milligram. You can start with morning and evening, and after a week you can make it 1 a day. And 2 weeks later, you may find that creatinine has started improving. So that is my suggestion to you, and that's the way I would have treated you with this. Then if there is any other question, Tara Tripathi, he says, colchicine kitni bar? Again, she's asking the same question. So normally we give 0.5 milligram of colchicine. It can be given for up to 2 years. In a COVID situation, we are giving it for 2 weeks. Colchicine is going to be a breaking inventory after steroid. I'm 100% sure colchicine will become like a aspirin for prevention of TH1 response, also TLR and NLR response. Colchicine is more for nod-like receptor response. And in such a situation, colchicine may become the drug of choice for all of you. And that's all for today. We will be back tomorrow at 7 p.m. with another show. So thank you, Dr. Tashi and Tanjin, and goodbye and thank you. You can give your final comments. If you want to give your final comment, you can give.
Oh, thank you so much, Dr. K. Agarwal. You have been doing really wonderful job in our female region, and we hope to see you on every Saturday.
Thank you.
And this is such a wonderful program that you are helping people. Like we have what we call BBS. It's like a television doctor. And right now, research facilities are not available here, but then Dr. K. Agarwal's expertise, and he is such a compassionate human being. I think he knows everything about COVID, from the gene to next variant to next medicine which will help to
Thank you.
kill this COVID. So thank you so much for.
Thank you and goodbye. We'll be back. Thank you and goodbye. Thank you.